Good morning to everyone. It's great to be here, and I want to thank PCOH and the sponsors for giving us the opportunity to share some of our thoughts. As you've heard, I think our leadership at DHS is very committed to oral health. You heard that from Secretary Arkush. Deputy Secretary Sally Kozak has reemphasized oral health. The fact that we have a chief dental officer that's very committed to modernizing our program is quite vital. And again, Sean mentioned the teledentistry, the street medicine. We're also looking again at making fluoride varnish more accessible on the medical side as well as the dental side. I also want to thank everybody in this room, especially how many are dental providers for Medicaid? I want to thank each and every one of you because you are the ones that provide service to our most vulnerable Pennsylvanians. You are the heroes in this room, and I want to thank all of you for being willing to serve our Pennsylvanians. We also have a brain trust in this room. We have a lot of dedicated folks from both a policy standpoint, but from a practice standpoint, in really solving the problems of access to dental care. We have the ability, I think, to really move Pennsylvania forward so that we're number one. We're not number 15. That doesn't make it in my book. I want to be number one in the country when it comes to oral health. We have a lot of workforce development ideas. I heard a lot of great ideas yesterday in how can we leverage telehealth, how can we get into schools to increase the access of direct care, or at least assessment in school-based models. We obviously need to think in terms of our pipeline of dentists and hygienists and other oral health professionals. We need to go upstream and think in terms of recruiting them early and often in middle school, high school, college, streamlining the educational experience so folks don't come out with a ton of debt. Or if they do come out with a ton of debt, that there's loan repayment programs in place, more than what exists today, to really help those individuals struggling with a huge amount of debt. We can solve these problems. I really think that the discussion yesterday about equity was really, really important. And one of the things that we're working on is really looking at restoring, hopefully, the adult dental benefit. When you think about it, you saw the slide about equality versus equity. When it comes to our adults, the dental benefit it's not even an equal benefit. It's not equality. It's not even equality, let alone being equitable. When you think about it, we have older adults living in nursing homes or living within the community in our Community Health Choices program that don't have access to full dental care. They don't have they have limitations on their dentures. Think about that. The vital importance, I'm a geriatrician, the vital importance of nutrition in those older adults. Think about individuals living with intellectual and developmental disabilities. If you're living in an ICF, you can get the full adult dental benefit. If you're not and you're living in the community, you have limitations and you have to go through the BLE process. It's not equal, and it's certainly not equitable. As an internist, when I think of you as dentists not being able to do endo or place crowns, to me that's like telling me that my type 2 diabetics, I can only use oral medications. I can't use insulin or other injectables. You shouldn't be limited in how you're practicing dentistry on our Medicaid recipients. I want equality. But equality is not good enough. I want equity as well. We don't even have equality when you think about it. When you look at periodontal care, think about all the inflammatory processes and the diseases that are associated with that, and the fact that you as dentists have to go through a BLE process to ask for that type of service. To me, that's not even equality, and it certainly isn't equitable. So I challenge everybody today, and really a call to action. I'm only one voice. Dr. Shamloo is only one voice. You guys sitting here in this room can make an impact. And you can work through PCOH and other venues to really make the voices of the most vulnerable heard. We can do better than where we're at today. So my challenge is really a call to action. Let's move not just to equality, but to equity. Einstein's definition of insanity is doing the same thing over and over and expecting the same results. We have a brain trust in this room. Let's sit down, let's figure out what we can really do to improve oral health care. Let's break down some of those barriers, some of those regulations, and let's really move the needle in oral care, for oral care here in Pennsylvania. Thanks so much, and I appreciate your time.